right. What should you do next? This is a two-step.
Okay. Now hold on
20.
for just a moment. So everybody in YouTube, how are we doing so far? For those of you on YouTube, Facebook, how are we doing? Let me know if you have any comments or questions. I'll try to go back and answer as many of those as I can. For the rest of you, let me know if you're having questions as well. But let's jump right back into it. So go ahead. Hold on. All right, let's go.
Okay, what should you do next? This is a two-step.
Okay, let's go. It's all you, my man.
All right. All right. 29-year-old pregnant patient is 30 weeks gestation and actively delivering.
Okay.
The baby's head. Oh, okay.
Keep going.
Okay. The baby's head delivers, but then retracts tightly against the perineum.
Uh-huh.
Gently downward traction does not deliver the anterior shoulder. What should you do?
All right.
next?
So what do we call this? What is this pointing to? What situation is this? Okay, cool. That's the turtle sign. So think of a turtle. So you got this little head, and then you got the shell or whatever, and the head kind of comes out and then goes back in. So that's the turtle sign. What do we do for that? If your protocol allows it, what do we do for this baby?
Is it Nick Roberts?
Okay, now how do we do it? So that's the what we do. Remember, level 1 knowledge is what something is. Level 2 is what do the protocols say do about it. Level 3 is the magic, and that's the how and why. What is the Mac Roberts position? What is that?
Is it on her? Is it on her? Is it on her side?
Okay, so some people will say kind of knee chest, where you're putting mom on her knees, but that's not the safest thing to do in a transport environment. So the better thing to do would to have her on her back on the stretcher. But what you're going to do? So here's mom, and so here's her arms or whatever. We're going to bring her knees up. We're going to bring her knees up like this. Kind of think of these knees kind of going toward the armpits. Okay. What we're trying to do is displace the angle of the pelvis to give more room for the baby to hopefully kind of slide out. Because what's happening is the shoulder girdle is caught on the pelvic canal, and we're trying to just kind of manipulate the baby so that we can get the baby to come out easily. Now, what we're not going to do is just pull on the baby. Okay, so all we're trying to do is kind of have her change the shape of her pelvis. Everybody following what I'm doing here with my hands? So just kind of picture her pelvis moving as you bring those knees up toward so some people say knee chest, but you also want to kind of pull on the thighs and move them like upward and outward. So the way I want you to think of it is the knees are going toward the armpits. Okay, that's the McRoberts maneuver. That's part of it. The other part is you're going to have, like, while one person is kind of holding the legs or bringing the knees up toward the armpits, the other person is pushing on the pubic bone. Now, where's the pubic bone? Now, that's way down here, okay? So that's way down here, not the fundus. So the fundus is the highest part of the uterus, and that's when do we massage that? When do we do fundal massage? Type it in the chat.
The hemorrhage, stop bleeding.
Yeah, that's going to be postpartum hemorrhaging, but this is not, in this case, in the McRoberts maneuver, we're not putting our hand at the fundus, which is the highest part. We're actually putting it down low at the pubic bone, at the symphysis pubis. Okay, so find me actually, that is the answer. So in this case, D is the answer. We're going to place this patient in McRoberts position and apply suprapubic pressure. So that's pressure above the pubic bone. Okay, and so that concept, that's turtle sign or shoulder dystocia. Okay, shoulder dystocia is where the shoulder is kind of caught on the pelvic bone. And so we're trying to manipulate the pelvic canal to make it easier and have more space for the baby to come out. All right, let's do another one.